This video discussion is about pyridoxine, corresponding to Antidotes in Depth Chapter A15 in Goldfrank's Toxicologic Emergencies. The learning objectives for this session are that you'll be able to list at least 2 toxicologic indications for using pyridoxine, explain the mechanism of how isoniazid toxicity induces seizures, and outline a dosing regimen for antidotal pyridoxine. Pyridoxine is vitamin B6, and it's converted into its active form by pyridoxine phosphokinase to form pyridoxal phosphate, or PLP. Pyridoxal phosphate is a cofactor for glutamic acid decarboxylase, which converts glutamate, an excitatory neurotransmitter, into gamma-aminobutyric acid, GABA, our primary inhibitory neurotransmitter. There are a few substances that will muck this up, such as isoniazid, hydrazines, and hydrozides. They deplete PLP by 2 mechanisms. First, by inhibiting PLP synthesis, and second, by complexing with any PLP that does get synthesized and increasing its renal excretion. Isoniazid and hydrazine toxicity result, effectively, in a pyridoxine deficiency, causing an imbalance in excitatory versus inhibitory neurotransmitters, where there's not enough inhibitory GABA, and there's relatively too much excitatory glutamate, potentially resulting in seizures. A number of the drugs typically used acutely to treat seizures, such as benzodiazepines, augment the action of GABA, but this means that they need GABA to be present in order to work. So the neurotoxicity and seizures from INH can be difficult to treat, since not having enough GABA is the underlying problem. To recap, this kind of toxicologic pyridoxine deficiency occurs from isoniazid, hydrazines, and gyrometrum mushrooms. In the middle here, we see the structure of monomethylhydrazine, which can be used as a rocket fuel. The gyrometrum mushrooms produce gyrometrin, which is actually converted into monomethylhydrazine. Specific recommendations for antidotal pyridoxine dosing exist, but only for INH-induced neurotoxicity, since it's the one occurring frequently enough for us to have enough data. INH is the most common drug to treat tuberculosis, and there's plenty of tuberculosis in the world, so we'll see lots more INH overdoses than from the hydrazines. Whatever dose of INH was taken in overdose is matched gram for gram with pyridoxine, up to a maximum of 5 grams in adults or 70 milligrams per kilogram in children. And since the most common packaging of IV pyridoxine is in 100 milligram vials, this means a maximum dose of 50 vials. That's a lot of prep work. The Goldfrank chapter authors recommend giving pyridoxine IV at a rate of 0.5 grams per minute until the seizures stop, and then any remaining pyridoxine is infused over the ensuing 4 to 6 hours. There's one more potential use of antidotal pyridoxine, and that's for ethylene glycol poisoning. One of ethylene glycol's toxic metabolites is glyoxylic acid, which is generally metabolized further into oxalic acid. But there is a side pathway converting glyoxylate into the amino acid glycine, for which pyridoxine, which is to say pyridoxal phosphate or PLP, is the cofactor. The dose of pyridoxine recommended for this indication is 100 milligrams per day. That's all for pyridoxine. I'll be seeing you around.